Hello, my name is Margo Cicero, and I'm a junior at Whitney M. Young Magnet High School in Chicago, Illinois.
How has COVID-19 affected your educational experience? How have you adapted, and what is still difficult?
COVID-19 has affected my educational experience because it's a lot less challenging because teachers are trying to help all the students, in this unprecedented time of learning. Also, in person, you have that teacher-student relationship where the student and the teacher both understand each other's educational habits and systems, and the education and learning process is a lot smoother and improved. One way that I have adapted in this online learning is I've kind of added more structure to my day that I don't get during online learning. I run every morning at a certain time, I get back at a certain time, I do my sport at a certain time, I come back, I go to bed at a certain time, and that structure has really helped me, deal with this new learning format.
What is an issue that you are passionate about, and how has COVID-19 affected it?
One issue that I'm passionate about is HPV vaccinations and sexual health in students and teens. And COVID-19 has impacted this greatly because now that we're online, students and teens are not getting the information that they're normally getting. There's less resources out there, and just students are not learning about contraceptives and STIs and HPV vaccinations as much as they normally would in school. There's less adults guiding them. They're not really asking other people in class about this. We're not discussing this in an open conversation, open dialogue, and there's just a lot less information out there.
Do you think adults or people in power have been listening to young people about the pandemic? Why is it important to listen to us?
I think adults right now in the pandemic are listening to young people and are very open to new ideas. In my own experience, we recommended policy changes to CPS, and we suggested different policy changes to the coronavirus task force for the Chicago Department of Public Health, and both leaders of these organizations welcomed and were very open-minded and implemented some of our best ideas in 3 weeks or less. And I think that students and teens and young adults in this age really are important. Our views are important because we see our future in 30 years and how the world's going to be when we're 40, 30, 25, 50, and we have a family and we have a career, and we don't want the world to be full of pollution and full of nuclear disaster and wildfires and hurricanes. We don't really want that.
What gives you hope for the future?
I think coming out of this unprecedented pandemic, the world will be a lot more welcoming to change. Change in almost everything systems, and I also think that people will be a lot more empathetic toward each other, a lot more kind now that we've gone through this isolation from social contact, and the world will just be a lot more open to almost every aspect. Thank you.